We were driving over to my sister-in-law's house, and within a minute that we were there, we just heard her, yell. We weren't sure what had happened. My husband was right near them, and he turned around and saw that she was holding her eye. And then we had just realized that, I guess, my youngest had grabbed a toy and swung it, and she was probably running around where he was playing, and it had hit her eye.
It was quite a severe injury. She has a very large laceration of the cornea, extending really from one edge of the cornea to the other. So it was quite a severe injury, and it actually opened up the eye. We call it an open globe injury.
The eye looks so horrible because of the injury, and there were so many parts of the eye that were injured.
Her injury was fairly severe initially, and we weren't really sure how that was going to turn out.
Told us, he wasn't sure she was gonna be able to keep her eye. His suggestion was, we'll have to wait a couple of days and then determine what had to happen.
So we assessed the injury as a corneal laceration with injury to the lens, and we repaired the cornea and took the lens out.
Approximately a week after the injury and the surgery, there was a problem that she had a blood clot that was not letting them see the back part of the eye. Then later on, as the blood clot cleared, she developed a cataract. She had cataract surgery. Once that happened, then we were able to confirm that the back part of the eye was in good condition. And that's part of the reason why she has such a good vision right now.
After that surgery, and it was a few weeks later when they did the test, because we couldn't open her eye, she had a patch on. And when they finally took it off and they did the first exam, and they realized that it had worked, obviously we were very happy.
Dr. Russo is our optometrist, who is a contact lens specialist and really good at what he does. And somebody with this type of injury, fitting them with a gas perm lens, because that gas permeable lens is what will really allow Sophia to see an image clearly.
The left eye will continue to wear a contact lens unless at some point in the future there's some surgical treatment to remove the scar in her eye. The scar itself causes the cornea to be irregular, and that's the purpose of the contact lens, is to kind of restore a normal regular surface so that she gets clear vision with the eye.
The eye is very valuable, very precious, but also very complex. And so we have subspecialists in all of these areas, and I think we're all very excited how things turned out.
As she's going through, through everything, and she was very strong. She's actually the one that kept us strong, because she just kept on being herself.
It just makes me so happy that she comes in and she feels so good, and her parents are so delighted, and she can do anything now. She can play, she can watch TV, she can work on her little crafts that she does, and it's delightful.
Working together, we were able to provide the care that she needed to treat the immediate problem of the damage to the eye, and then provide her the long-term rehab service that she needed so that she could have a very functional eye to use for the rest of her life.
I want to say thank you to all my Loyola doctors.